It's Wellness Nerd Out time! Good morning, you guys. Happy Wellness Nerd Out time. What I want to talk about today is spinal curve correction. So, some research has shown up to 18% increase in cervical lordosis. That's curving this way, right? How our neck naturally is meant to, as a spring. We'll talk about all that in a second, to hold the weight of our head and allow the proper functioning of our nerves. 18% increase in cervical lordosis over the course of 10 to 14 weeks. I think it was 30 to 40 treatments with cervical extension retraction as part of a multimodal rehabilitation program. Okay, so there is research behind it now. That is spinal correction, actually being feasible, right? Because you may think my cervical curve or my thoracic or lordotic lumbar curve is something that I can't really change. It's been something that's been impacted by my everyday activities, my lifestyle throughout my entire life, right? So, what are some of the long-term issues we can look at here if we don't get our curve corrected, right? Well, of course, we know our central nervous system controls everything in the human body, right? Our efferent signals or our motor signals, our afferent signals or our sensory signals going up the cord back to the brain, right? And so the curve is naturally lordotic, if I was looking this way, right? Just so you can see it better. So what happens if it gets straighter? Well, what's going in the middle of all these vertebrae through the vertebral canal? The spinal cord. What's exiting through the intervertebral foramens at each level? Well, exiting at the intervertebral foramina would be our spinal nerves, right? And these nerve roots. And they go on to become peripheral nerves, control everything in the body, right? And so if our curve is more straight, as we could say, something like military neck, for example, where we have what we call a hypolordotic curve, well, then that's extra pressure on not only the nerves and can cause some symptoms, and especially if you get in an accident or you do some physical activity that is unnatural, or it can do damage. It is much more likely to do damage if your curve is not correct in the first place. And because what this is doing is putting extra stress, again, on the nerves, but the intervertebral discs. It's increasing your risk for disc degeneration and for herniation and bulging and herniation even, right? And so you got to think of that stress all day with gravity coming down on we're using the neck as an example here. Same goes for the low back and the mid back, whatnot. But the neck's a good example. A lot of people with back pain, right? And low back pain. But that stress over time, now these discs are getting compressed, and it can lead to less blood oxygen and nutrients getting to the discs, reduce their health, and again increase that risk for herniation over time. So if I have herniation already, or bulging of a disc, can spinal correction help? Yes and no. I mean, yeah. The reason I say that and no is because, primarily what we do, flexion distraction. We open up. That's where your legs move up and down on the table. We open up that space with you on your stomach, so that every movement, when your legs go back, it opens a space in the vertebral joint, allowing the disc between the vertebra to leak back in, to fall back into place over time, using gravity to aid that process, right? And so if you have herniations already, and you have a hypolordotic curve, again, for example, it's not like this, it's like this. Well, what do you think? I mean, that's a lot of extra pressure vertically, with gravity coming down every day, biomechanically coming down on those discs. So it may take longer for them to heal. Absolutely. So spinal correction and flexion distraction, that's why I said yes and no. It does help, but we would do both, among other things, exercises and stretches and things like that, to help with herniated discs, to help them recede back into the intervertebral joint, right? So that's pretty much the case with spinal correction. Now, you know, generally, again, you know, something like 30 to 40 visits is different for everybody. You know, we talked over the matter of a few months with that study, but you know, it takes different amounts of time for everybody. What we do is we'll take x-rays at first to see that curve, then we'll take them after and we'll see the difference, and the proof's in the pudding. You see a significant difference over the course of treatment with your curvature in your spine with spinal curve corrective treatment, right? So definitely something worth looking into, you know, whether you have issues already or not. If you don't, you can do it for, you know, the prophylactic preventative sense of, you know, making you less likely to suffer degeneration over time and to be in pain and to reduce function. So can it affect function having an improper spinal curve? Now, you know, we said a little bit that it could, but absolutely. You know, we're talking about the health of the disc. We're talking about the nerves. Like we say, the nerves control everything in the body. So if there's extra pressure on those nerves due to an improper curve, an unnatural curve, of course, we can get excessive pain. We could have motor deficits, things like that, right? Muscle weakness and sensory stuff like tingling or burning or numbness. And that's what we got for you guys today. I hope you got something out of this. That one was for you. You know who you are. But we don't give any patient information away here, obviously, HIPAA violation. But have a great rest of your day, you guys. Thank you so much. Happy Wellness. We'll see you tomorrow. Have a good one. Thanks.